It's 2:59, so probably give people another minute or so, Donna. Donna, can you hear us? I can see her, but I don't know if she can hear us.
I can hear you just fine.
But Donna, I'm saying.
I imagine she can.
Because I can see her. She's supposed to give an opening message, but I don't know if she can hear.
Good afternoon, everyone. I want to welcome you to this Zoom call. I have it that it's 3 o'clock. I hope that everyone's day is going well. It was a beautiful weekend, and we will have a short week this week. So I'm glad everyone is preparing to have some time off. So that's great. I'm going to wait a couple more minutes before starting so that I see that we have 21 people on here now. So let's give it a couple more minutes before we actually start our presentation. And can everyone hear me?
Yes.
Yes.
Okay. Okay, let's start our meeting. So this afternoon, we are excited to be here to present this program to you. We all know how important our health benefits are as a group, and it's one of the most valuable benefits that we have. And I'm pleased to say that we have found a way to continue to provide the high level of health benefits you're accustomed to at a lower cost. The advantage to you is that the premium cost is being reduced, and therefore the amount of your contribution will be reduced. As you know, everybody pays for their health benefits based on their salary and the premium that they've chosen. So it's hard to identify what your exact savings are going to be. We ran a couple samples and we found that overall the savings are about 10%. So if you wanted to look at your pay stub, see what you were contributing to health benefits, take 10% of that, and that's a savings that you would see in each paycheck. And again, this will be different based on everybody's salary and the plan that you've chosen. The training for this afternoon will be for the people in the PPO plan. The way the difference card is implemented is different for each plan. In the PPO plan, you will not be getting an actual difference card. The reimbursement process that you use will be different, but you won't get a physical difference card. I'm happy to say today we have two new partners with us that make all of this possible. We have Simone from Alliant Benefits. They are our new benefits broker. And we have Scott Abrams from the Difference Card, who will be explaining to you the process of what is a little bit different for you when using the difference card. The difference card mechanism, not the actual physical difference card. So they will present the program. We will put this training program online. And if you have any questions, feel free to contact me directly. I can, if I don't know the answer, I will contact either Scott or Simone. And we are all committed to making this transition smooth, to working together, to helping to resolve any issues you have. When we investigated these companies, one of the key elements that we looked at was their customer service. And the difference card got rave reviews from everyone who has used it. And one of the things they said that was very positive was that their customer service was excellent. So they are committed to helping us through this process. So if they would like to start, Simone, please take over.
Thanks so much, Donna. Good afternoon, everybody, and thank you for joining us on this beautiful day, Monday afternoon, to go over benefits training and a slightly new way that your benefits will be utilized that you need to get familiar with starting July 1st. A couple things that I just want to notate. Your deductibles start on a calendar year basis, not a plan year basis, and this has been ongoing since your plans were enacted, which means that even though the plan renews every July, your deductibles reset in January, which means that if you have already met your deductible, then you don't need to re-meet it in July, okay? We're going to be introducing the difference card. So the difference card is the name of the company. Like Donna said, it's not an actual physical card. So I don't want there to be a confusion that you're going to be getting some sort of card in the mail because it's just the name of the company, like Alliance, the name of a company, and Berkeley Heights Board of Ed is the name of your school. So the difference card is just the name of the company. It's a new way for you to pay for your benefits. By introducing the difference card, there's going to be a decrease into your contribution costs that you pay for the medical plans. The PPO plan will work with the difference card. So your chosen doctors, hospitals, and other providers are going to remain the same. So you're not going to have any disruption of any of your networks and doctors that you're currently using. It's going to continue to be the same Cigna network that you're accustomed to having today. Your copays, deductible, and coinsurance amounts will remain the same. So your plans will have the same level of benefit that you're accustomed to and that you have currently today. You will be receiving new Cigna cards that will be mailed to you between now and July 1st. The new Cigna cards are going to indicate the purchased plan that we're going to get into and educate you on within the next couple of slides. But you're only responsible for what you have been responsible for in the past with the current plan design. Your ID number on the Cigna card is not going to change. So if for some reason you don't get a new card before July 1st, that's not going to preclude you from going to the doctor because that ID number remains the same with Cigna. It's only the deductibles and things like that that are going to change on the back of the card. So not to worry. Okay? The difference card is a funding mechanism used to subsidize medical expenses. It is paid for by Berkeley Heights Board of Education. The difference card is designed to keep expenses the same as
Simone?
I think we lost Simone for a minute there.
That's okay. If she's having technical issues, you could give her like 20 seconds to jump back on, but I do have the presentation ready, so I could just share my screen and I could take over where Simone left off.
It's whenever you want, friend. I'm just the tech guy. Whatever works
All
for
right. Perfect. So let me pull it up and let me share my screen because Simone's having technical issues.
I'll keep an eye on for her.
Hello?
Hi, Simone.
Hi. I'm not sure what happened there, but I think I lost Wi-Fi for a minute or so. So sorry about that. Where were we when my computer dropped off?
So we were right at the really the difference card slide, and you're getting into really the introductions of it. But can you see my screen, because I pulled it up?
Yep, I can.
Right,
So sorry
perfect.
about that, everyone. So your technology, right? We all love technology. So your difference card will be used to help pay for the following expenses. So deductible and coinsurance, office visit for specialists in primary care, and visits to urgent care and emergency services. So keep in mind that your cards are going to remain the same ID number that you currently have today. So not to worry if you don't get your card by July 1st, you can continue to use the card you have until you receive your new card from Cigna. That's the only card you're going to be receiving is a new card from Cigna. Okay. Next slide, please. Nope. Share my screen.
Do you want to take over, Simone?
Yep. I'm sharing my screen. Okay, can you see my screen?
I
Not yet.
saw your screen before it was up.
Okay, the high-level summary of Cigna and the difference card, do you see that?
I don't. I don't know if anybody
No,
else
not-
sees it.
No, not yet, Simone.
Okay, what is happening? Okay.
Now we do.
Okay, great. Okay, so this is a high-level summary of Cigna and the difference card. So your current plan design is the plan that you have that will, in essence, end on July 1st. So that is a deductible plan with coinsurance, out-of-pocket, and cost. So the primary care physician and specialist is subject to a $250 single deductible and $500 family. The new purchase plan has a higher deductible, higher coinsurance, and out-of-pocket costs. And what your card from Cigna is going to indicate is that the purchase plan is going to say $2,500 single deductible, $5,000 family deductible. With the new Cigna plan and adding the difference card vendor, they are going to reimburse for the difference in the current plan versus the purchase plan, bringing the deductibles to be the same, the coinsurance to be the same, and the out-of-pocket to be the same. So the single deductible is $250 and it's $500 for the family. Are you still with me?
We're here.
Okay,
Yep.
great. High-level contribution summary. So this goes into the detail of how your rates will be lower than what you're currently paying today. So we have two examples here. The first example is an employee making $72,000 a year and paying 32% of their premium, okay? So, for example, with the current Cigna plan, the single rate is $14.46. The employer pays 68% of that, so that's Berkeley Heights contribution to your medical plan of $961.83. And you as the employee under that salary bracket are going to pay 32% of that, so it's $452.63. The new plan with the difference card vendor is going to be $1,268.14. Your employer is now paying $862.34, and you as the employer are now paying $4,580, with a reduction of about 10.3% in aggregate to from what you're currently paying today. The next example is an employee making $100,000 a year and paying 35% of the premium. So that employee family rate under the current plan is $29.2955, having the employer pay 65% at $1,904.21, and you as the employee paying 35% of that at $1,025.34. The new plan with Cigna and a different card vendor is $2,626.50. The employer paying 65% of that at $1,707.23, and the employee, and that would be you, the employee, at 35% at $919.27, with an aggregate savings of 10% coming out of your paycheck. Okay. I'm going to turn it over to Scott, and he's going to go through exactly how it's going to work so you can be educated on the process going forward effective July.
All right, good afternoon, everyone. I'm going to go through how your difference card benefits work with your Cigna plan, really starting out with this grid. But as Simone said, none of your benefits are changing. Your plan design and your out-of-pocket costs with your health plan are remaining exactly the same after July 1st, 2020, as it is today. So looking at this grid, on the left-hand side are your benefits with your health plan. That Cigna benefit column is just the purchase Cigna plan without any reimbursements involved. The difference card pays column might as well say Berkeley Heights pays, because that's what your employer is funding toward each of your benefits. And that you pay column is exactly what you're responsible for at the end of the day for your benefits. You'll notice if you know your benefits off the top of your head, that you pay column highlighted in yellow, it's exactly what your out-of-pocket is today. So like Simone said earlier, there's really no actual difference card, MasterCard involved with this plan. Everything is what would be called a manual submission or manual reimbursement. Because you have a high deductible health plan with this Cigna PPO plan, there are no copays on the plan when you go to the doctor's office or the ER or the specialist. Really everything goes toward either your in-network or out-of-network deductible. So if you go to the emergency room with this plan, you'd be exposed to your deductible. The difference card will pick up the full amount of your emergency room costs. So any emergency room visit for you, regardless if you met your deductible or not, is $0 out of pocket. It's free. Same rule of thumb when it goes to your urgent care. If you go to the urgent care, you'll be billed afterward and you'll get an explanation of benefits from Cigna. That's that piece of paper that says this is not a bill, but it looks like a bill. Really, it shows what that facility tried to charge you and then what your responsibility is with your Cigna plan. You send that explanation of benefits to us at the difference card. We'll fund the full amount of your urgent care visit. Every urgent care visit is free for you as well. Now, when it comes to your in-network deductible, so we're thinking of really all your benefits, your primary care specialist, your inpatient hospitalizations and surgeries. On this Cigna plan, you have a $2,500 deductible. Of course, you're not responsible for that because Berkeley Heights is paying $2,250 worth of your deductible. So your out-of-pocket has remained the same. You're only responsible annually for the first $250 worth of your deductible. Now, if you do max out your deductible, that's when in-network coinsurance kicks in. This benefit is remaining the same as well, where you're only responsible for the first $1,750 worth of your in-network coinsurance. The difference card will pay the remaining $2,100 worth of your in-network coinsurance. Now, on this plan, you have out-of-network benefits as well. So if you have doctors that are not in Cigna's network, that are not contracted with Cigna, this is where these added network benefits come into play. On this plan, you're responsible, again, for the first $250 worth of your in-network deductible. So it's exactly the same. It's exactly the same out-of-pocket as the in-network deductible. The difference card will pick up the remaining $2,750 of your added network deductible. If you max out that added network deductible, you'd be responsible for the first $1,750 of your added network coinsurance. The difference card will pick up the remainder. So let me use a scenario. Say I tripped and fell and I need to get surgery on my leg. I go to an in-network hospital, they take care of me and they discharge me. When that hospital discharges me, they'll send me two things. I'll get a hospital bill. It could show the full retail price of that procedure, but I'm not responsible for that hospital bill alone because I have health insurance. I need to wait for the Cigna explanation of benefits with Cigna letterhead on top of it because I'm insured and I'm never responsible for the full retail price of any procedure. That Cigna explanation of benefits might say, Scott, you're responsible for $2,500 worth of your deductible because that surgery was expensive. Now, I'm not responsible for that. So what I then do is submit the explanation of benefits to the difference card. We'll go through how to do that, but you could do it on the web. You can mail or fax. You also can submit it through a mobile app. Once I submit it to the difference card, within a few business days, the difference card will reimburse me, but on the front end, so I can pay off that medical bill. So in that situation, if I had an explanation of benefits that said I owed $2,500 worth of my deductible, the difference card will send me either a check or a direct deposit for $2,250, so I could then pay off that hospital bill or hospital claim. Now, we always send the funds to the member to go pay off that medical bill. Because you have health insurance, you're not responsible for any portion of your deductible up front. So if you're in a hospital situation, always tell the facility to bill you afterward through your insurance, which is customary. If you have any issues with that, reach out to either Donna, myself, or Simone. We'll go through how to do that. But once I get that check or direct deposit from the difference card, you have to then go pay off that medical bill. If you get a check from the difference card and you go buy a nice flat screen TV, that's a really nice flat screen TV, but that bill will still be outstanding. So I just want you to understand the process. Now, when it comes to your added network benefits, it's definitely more financially advantageous for you to go in-network because in-network doctors have specific contracts with the health insurance carrier. When you go out of network, you could be subject to what's called usual and customary billing. So really out of network doctors don't have contracts with Cigna, so they can charge you far above what's customary. And then Cigna can say, well, we're only going to cover a cost of it and really leave you on the hook for the rest. If you go use out of network providers, you're probably already used to balance billing. But Cigna does have a very large network. So if you have to go out of network, of course, you have these benefits for that purpose. But it is more financially advantageous to stay within the network. Moving on to the next slide. So this really reiterates in a detailed breakdown of how to submit for manual reimbursement. I went through that scenario where I was hospitalized, I got an explanation of benefits from Cigna, and I submitted it to the difference card. Your Cigna login, if you have a member login, is not going to change, and I definitely encourage all of you, if you haven't already, to create a member login on Cigna's website. You can find a full history of your claims through that website and through the mobile app, and you can find those explanation of benefits that we've been discussing. You can go to thedifferencecard.com. At the top of our website, it's a bright blue button that says submit claims. You can really just attach the claims to our secure email feed and submit them digitally. If you go through the next page, it goes through how to 4 ways to submit a manual claim. So definitely doing it online is the fastest, easiest, and most secure way. I definitely encourage digital use. We also have a mobile app, and you won't be able to register until July 1st, but using the mobile app is also a great digital resource. If you do have paper explanation of benefits that come in the mail, you can mail or fax them to us. Our office is based in White Plains, New York, so it won't take too long. But of course, keep in mind our current state of events where the United States Postal Service isn't operating at maximum efficiency. So it definitely may be in your best interest to do everything digitally. Okay, signing up for direct deposit. So like I said, every time you submit a claim to the difference card, we'll either send you or send you a check for your benefits or direct deposit. I also very much encourage direct deposit. It's faster, it's cleaner, it's easier. Once your effective date comes, which is July 1st, you'll be able to make a member login. You can go into your portal, change the reimbursement preferences, and then really tap into or type in your direct deposit information rather than getting a paper check in the mail. But either way, you could choose what your preference is. To sign up for a member account, and of course we'll re-blast out this information. There will be follow-up education sessions. We'll if you don't remember everything today, that's fine. We'll help you out along the way. But you can register on our website come July 1st. The first time you log in, your username is your social security number, and then your password is your date of birth. As soon as you register, you can update your username and password. But this is also a great resource, so you can track claims, submit claims, and it's just a nice self-serve tool for you. We also have a mobile app, Difference Card Mobile, on the iOS App Store or for Android. So I definitely encourage you all to download the mobile app. We will send out a registration code, but similar to the website, the member login, you won't be able to register for the mobile app until your effective date of July 1st. So definitely be on the lookout for more information about your registration.
Great, thanks, Scott. So in addition, we have an abundance of resources available to every employee at Berkeley Heights. However, we encourage that in the beginning, any questions that you have, you go through Donna so we can kind of keep track of, questions that are coming in. And then she will, either come to me or come to Scott so we can kind of find a resolution or help every employee with any questions or situations they may encounter. However, we have a benefit advocacy team through Alliant that's available via email or phone number that will be offered to everyone who needs help with anything, as well as the Difference Card company also has a public sector customer service care line that is also available to everyone. So we have an abundance of resources to ensure that everyone is fully equipped to maximize the usage of their benefits through the township.
All right, thank you both, Simone and Scott. I appreciate your taking time this afternoon to go over this with everyone. If anyone has any questions, we do have the chat that you can ask right now. If not, I know this is a lot of information. You can think about it, think about your own personal situation and how this would work for you. Email us your questions and we'll get back to you with the correct information. Again, your benefits are remaining the same, which is very positive, and your cost will go down. We want to welcome the two new teams that we're working with here to be able to accomplish this. And we will be posting this presentation so you can go back to it and read it and see what the steps are, get the phone numbers, etc. So they will be posted on the district website. So thank you for your time this afternoon, and feel free to have any questions. Let's see. There's a question here from Patty Gasparini about doing the work to get reimbursed. The process, Patty, is really you submit the claim and then you will get reimbursed from the difference card, and then you pay your doctor. So that is the process.
Right, so for those folks who have met, for example, an individual, if your deductible started in January, let's say you already met your deductible, so you don't have to wait to meet any deductible after July 1st. Once July 1st comes and you have a service that's rendered and you receive an explanation of benefits with the amount that's owed, you submit that to the difference card. And I pulled up the chart again on the screen so you can kind of see the difference. So you will submit it, and then you can submit it either through a fax, through mobile, or you can mail it. You can email, whatever. We try to make it really easy, so whatever your choice is of taking care of things is available to you.
And just piggybacking on what Simone said, yes, we understand this process is new, but we'll hold your hand and make sure we make it as seamless as possible. Really, the claim submission process is almost identical if any of you are used to a flexible spending account plan. The claim submission process is identical. So we just need the proper information, which is that explanation of benefits. You submit it to us, and then really we give you the money to pay off that medical claim. So if you're thinking about it or trying to wrap your mind around it, think about it in terms of it only affects your medical plan, but the submission is very, very much like an FSA plan if you're used to submitting claims for your FSA.
Okay, there's another question about all of the, like your family members. Do you have to set up an account for every family member, or is it just, or do you create one account for yourself and then your family is covered under that one account?
That's a good question. So I can't speak to Cigna, but for the difference card, really it's just the primary employee. You have to log in, and then your spouse and dependent information, if you're in a family plan, will appear below your account. So really only you, the primary employee, has to sign up or register on the website.
Okay. There's a question about if you can explain how the network is paid. Previously it was 80%. How is it covered now as far as the deductible?
So there's no change in that. So whatever the coinsurance was previously, that's how it's going to be covered on a go-forward basis.
Okay. All right. Again, thank you all for joining us. If you have other questions, feel free to email them to me. Again, we are not stopping here today. We will continue to support you and help you through this process. And I would think that in 2 or 3 months, this will be down pat and you won't have any questions. So thank you all.
Yeah, and I just wanted to just mention that at the end of August, when we plan on coming out and being live, if we're allowed to, hopefully, if everyone's out of quarantine and we're allowed to congregate somewhat with each other. And we hope to be available in person so we can meet everyone and also answer any questions. And then at that point, you will have probably utilized the plan a little bit in the summertime, and you can kind of get to see what the process looks like, and we can help you at that point in time as well.
All right, I see one final question, Simone. It says, what if a facility or pharmacy wants to be paid up front? I'll try to answer this and then you can tell me if I'm right. But I would think you pay it and then you submit to the difference card in Cigna and you get reimbursed for your payment. Correct?
That is correct Donna, but I'm going to add a little bit more
Okay.
color to that situation. So I see from Maria the question. First, I'm going to tackle your pharmacy benefits. Your pharmacy benefits are staying exactly the same. There's no difference card involvement there. So your pharmacy benefits will be the same after July 1st as they are today. When it comes to if a facility asks for money up front, say you're getting a surgery and they're supposed to bill you afterward, reach out to us at the difference card. We have a concierge service. We're used to medical billing practices, even though they're supposed to bill you afterward. 9 times out of 10, we get them to pay them after the fact, which is customary, or just generate that explanation of benefits. If we do have to coordinate a payment up front on your behalf, so you don't have to pay out of your own pocket, we can do so, but it's a rare occasion. But reach out to us if you're ever in that situation.
Good answer, Scott. Thank you. All right, if there's no other questions, again, thank you for joining us this afternoon, and we aren't going anyplace. We will all be here to help you through this process and respond to questions or situations as they arise. So feel free to reach out to me first, and then if I can't answer it, or if I'm feel we need more help, I will reach out to either Simone or Scott. So thank you, everyone.